Good afternoon. Thank you for being here. It's a nice day out, so let's go through this, and maybe some of you don't have to go back to work. I do, but Ann Rooney does too. Ann Rooney's got to go back to work. Let's go through this. Unfortunately, we lost a member of the community to COVID over the last 24 hours. African-American male, 64 years of age. Thinking about him and his family and the 694 residents we've lost through the pandemic. Positive rate pushing up 1.5%, 7-day average, 14-day average at 1.2%. We are seeing an uptick in cases, a variety of factors. We'll go through them. Today we have 143 new cases. We've now had 33,898 cases, confirmed cases of COVID-19 since March 16th of 2020. Our active cases jumped due to the 143 new cases to 681 active cases. The uptick in cases, lots of reasons why. One, certainly it's been widely reported by the CDC that the UK variant is becoming more and more prevalent in the country. We've talked about the race with shots in arms versus variants, how this potentially could happen again, where we saw upticks in cases as the variants are more contagious, not necessarily different impacts on the health leading to hospitalizations. Also, we have seen now 3 straight days, 10% of our cases have been travel-related. What we're seeing is that people went on break. They went to other states. We recognized that was going to happen. We knew we'd see an uptick. But you're seeing, families, complete families coming back with vacation that have it. So that's going to lead to some numbers. Remember, whenever you have a case, there's a 20% chance that anyone in the household is also going to become positive. So you have household contacts when you have increased cases too as well. Young people still leading the way with cases. 79% of the cases under 40, 89% of the cases under 50. So the positive news there is that the vaccine continues to show that it's effective and it works. The age groups that have been vaccinated for the most part aren't represented in these numbers very much. Certainly there are those who are older than 50 that did not get the vaccine, and if you didn't get the vaccine, you're more likely to get the virus. It is what it is. It's the science. So overall, we don't like a day where we're over 100 cases, but let's take a deep breath, and we'll see what the data continues to show. We had 37 2 days ago. High day. When you average it out, it's right where we thought we'd see it, between 80 and 100 for the next 7 to 10 days. And then hopefully we'll start to see that immunity setting in with the vaccinations in these groups. Hospitals down. 32 people are in the hospital. 5 people are in the ICU. That's a good trend. Other communities in New York that have seen a recent uptick in cases, in Western New York and even the Finger Lakes, they've seen a harder uptick in cases, but they've also seen an uptick in hospitalizations. We have not seen that yet, so we'll knock on wood there. The vaccine is really how we end this pandemic, and it's going to start getting more difficult to get people through the mass vaccination sites, and so we still have that going. Let me give you some details on what we have going on related to the vaccine. Tomorrow we have a first dose clinic here, Johnson & Johnson, so 18 years and older. I think we still have a couple appointments available on that, but tomorrow's a big clinic here for the J&J shot. We will also be doing a pop-up clinic tomorrow at Lemoyne College, so we'll be up at my alma mater, vaccinating students tomorrow as well. Monday, April 12th, and Tuesday, April 13th. This is important, so hopefully the media will report on this for us. Our second dose drive-through clinic at Shoppingtown. Remember, we had the two clinics at Shoppingtown. We're doing second shots here. Why are we doing that? Because the weather looks spotty at best. So if you got a first dose at Shopping Town 3 weeks ago, we need you to come to the On Center tomorrow and on Tuesday for your second dose. We apologize for the inconvenience, but like many things in the pandemic, we do not control the weather. And I hope the weather people better be very good at their job on this, because if it turns out to be nice days, I know I'm going to get a lot of phone calls yelling at me for moving it from Shopping Town to the On Center. So hopefully our weather folks are on the money on this one. We have surveyed all of our public high school districts, gauging interest amongst families for children over the age of 16 to be vaccinated. We will start scheduling vaccinations next week with different schools. We'll also be working with the private what's the best way to distribute the vaccine with the infrastructure we have. But again, 16, 17-year-olds need parental consent or consent from the 16 and 17-year-olds. This is a demographic that's behaves more like your 18, 19, 20, 21-year-olds socially. So there is more risks there in those age brackets for transmission of the virus. So we got a lot going on. As each week we go through this, we'll begin to do more and more pop-up clinics, whether we're doing a pop-up clinic with business and manufacturing or we're back at a college. It's likely next week. This week we got 1,500 shots up to Syracuse University. They're working on vaccinating students through the week. Next week, based off of the registration, their pre-registration model, and we'll go up and do a large clinic up at SU. Details will follow on that. Testing, I ask people, I know we're getting tired, but I ask people to hang in there with us, take advantage of the testing. It's our tool to really find the virus and then box it in and end that network of the virus right there. We'll continue to do community sites today. Now with the community sites, because the demand is down, the hours are starting to be more limited. So when you set the appointment, it's not going to be kind of the walk-in type scenario where you'd be able to get on that morning and get an appointment potentially. So please, each day we're at a different end of the county at one or two sites. Please get there when you need to get there so we can get you tested. Today we're in Onondaga Town Hall and Shove Park this morning. Tomorrow we will be at the Clay Senior Center in the Fayetteville Village Hall. If you are symptomatic, you need to go Monday through Friday to the F Shed 9 to 1 and get a PCR test there for us. As we start to continue to transition from the COVID pandemic, responding and mitigating and now vaccinating, we're seeing more of the damage this virus has done to our community. The opioid dust was something that we've been talking about for a while, and we knew it was going to be bad, but it was our worst year we've ever had. 156 deaths in our community from overdoses. Again, the previous high, 142 in 2016. So if you think about it, we know why it makes sense why, we're talking about folks who, in their treatment, part of their treatment is interaction, engagement, employment. And what did we just go through? We went through isolation, unemployment. When you talk to professionals, some of the worst things that could happen to an addict is to be unemployed and then to have more money when they're unemployed with the extended benefits. So unfortunately, we lost more people this year, and it's something that this has been a priority of our drug task force, and that will continue to be a priority, and we'll get re-engaged. We have lots of initiatives that we do with Narcan training. We link people to treatment with our partners at Crouse and Helio Health and others. And we work with doctors to limit unnecessary pain medication for prescriptions. We're going to have to do more, and we're going to do more. But what we really need to do is we got to get our service community back to in-person activities, and we got to end this pandemic. We got to get together again so we can deal with these other issues. We talked about mental health with kids. We've talked about suicide. Many of these individuals that we lost in 2020 were victims to the pandemic, just like those that we talk about every day. So we got our hands full with this. We're going to need a community response to this. Saying that, happy to take questions.
County Executive, what would you say to teens or their parents, but mainly to teens who are nervous about getting the vaccine?
Yeah, so if you're 16 and above, the Pfizer trials that were done factored in a 16-year-old the same way they would a 60-year-old, right? So I think people, I received the Pfizer shot myself twice now, and I'm here today, right? I'm looking at you, I just think that what's the alternative to this? So. I understand some people don't want to get the shot. They never will. They don't believe in the vaccines, not just this vaccine. I appreciate that. We're not suggesting that people have to do it. What I am suggesting, though, is that this is the tool to get our lives back, and it is working. I can show it works. I can prove it works because I see the data. We all see the data. We report on it. There's next to no cases in the age groups that have been vaccinated for a period of time. So it works. It's safe. The best way to get our lives back and get these kids, these young kids, 16 to 22, a lot of these kids are in some form of education. To get them these years back that they'll remember the rest of their lives is let's get everybody shots in arms. And that's my message.
Ryan, what kind of volume is the county doing in vaccines now per week?
So, Tim, we're probably doing about, depending on what we have, each day you could have no-shows, right? And you have second shot no-shows every once in a while. Then you chase them down and you'll make them up a different day. But we're our range between 6,000 to 9,000 first shots a week, and second shots pretty much the same range. Some weeks it will be higher, some weeks a little bit lower. With the J&J being somewhat new for us as a tool, this week it's a big tool. We mostly have J&J. Next week we won't have as much of it because of the Baltimore situation. But what's nice about that is it's one shot, right? So you don't have to plan the second shots, so that do more output. But the challenge we have is I think the output is going to slow down drastically. We had about 186,000 first shots going into today. We'll probably do in the community 3,000-4,000 shots today. We got 360,000 adults, right? So we're getting close to, I think we're at almost at 52% of adults have been vaccinated today. It's going to start getting hard in a couple weeks. And that's when we really need to work with our community partners to get out there. We'll start doing reverse 911 calls for pop-up clinics, walk-up pop-up clinics in neighborhoods. These are all things that we're going to have to do and make it really easy for those that maybe just don't have hesitancy. They're just busy.
Are you, so far, have you been able to fill all the slots you could do? In other words, you're able to use all your supply?
Yeah, we're not hoarding vaccine. So this week we'll do, my guess, probably between 7,000 and 8,000 shots. We do have some Pfizer that we'll probably hold on to for 16-year-olds next week. But next week could be in the same vaccine week, Wednesday to Wednesday. But yeah, so we have some Pfizer. We don't know what we're going to get yet next week. So some of the Pfizer we have now, we're going to try to target that to 16 and 17-year-olds. And the J&J we'll use for everybody else this week. But again, your pharmacies all have appointments. The fairgrounds, I'm pretty sure, has got appointments. The supply is outpacing the demand, and that's okay, right? We wish we got here a little faster. It would have been a little bit less stressful, but we knew we'd get here at some point, and now is where we have to get out into the community more when and you'll see probably the mass vaccination site models being used really when you have high second dose days. And the rest of the days will probably be teamed up in different spots in the community.
What can you tell us? Can you tell us a little bit more about the large clinic at Syracuse University next week? How many people you're hoping to reach through that?
Yeah, so we'll get our teams and their teams together, and we'd like to do as many as we can. I think the question will become a little bit too on their pre-registration process and some of their exit polling they do when they have kids who test. Their kids are getting tested every week up there. That a lot of the kids have gotten vaccinated, more than we probably thought. And so they had over 3,000 yesterday pre-registered kids that will start getting shots, and that number will grow. But our hope is next week's clinic will get to as many as possible. So it could be a 2,000 shot clinic, it could be a 3,000 shot clinic. And again, if we have to go back, we will and do it. This is clearly the virus is on college campuses, but it's more than that, right? Families have brought them back, and young people who are active, who haven't been vaccinated in other parts of the community, the virus is still here. So we'll be very active to try to get through the congregate settings that we know we can get to people and monitor and track how well we're doing. And that's college campuses. We'll be up at OCC, I think, next week too, potentially. I think we have something lined up there as well. So we're going to get through all that, and then we're going to get very active in the community and hunting for arms to put this vaccine.
Is it going to be at the Dome?
Likely. Yeah, I think there's still some logistics, but you have the Dome, Manly maybe, but I think the Dome's easier being right on campus.
And considering you were saying young people are leading the way, I guess what message do you have to them, or what are you hoping the impact will be with these large clinics and the efforts to reach campuses?
Yeah, I think so far we've had pretty good participation. I think we'll hit, if 70% is your number that you need to hit across the board, or 75, I think we'll get that at campuses. I think we'll probably do better than that, quite frankly. And they got time left in their semester. Some of them are juniors, seniors. I would think you'd want to get the shot and build up that immunity as quick as you can, so you can start, enjoying some of the restrictions that come with the vaccine. At least I would.
County Executive, you touched on mental health in your remarks earlier. We know you've set aside $5.5 million to develop these mental health clinics in schools. But in addition to that funding, what are you hearing from people that need help? What are you hearing from people?
Yeah, so a couple things. I think one of the important things that we can do as a community, and that we really should be able to talk about, is that it's okay to need help, right? And so I think traditionally that hasn't been, there's been a stigma related to mental health for a long time. And so your brain's just like your body. And I think the more we realize that, and the more we take care of our bodies and our brains, the healthier we are. So first off, it's okay. Asking for help's cool. Okay, and then from you go there, what we've seen with our caseworkers, and again, part of our frustration, you can go back. We've done a lot of these briefings. There's a lot of video, right? Part of our frustration early on, and some suggested I was very moody that day, when these plans came out, these hybrid plans, we were frustrated because we foresaw what some of the things could happen, and we thought we probably could have did a little bit better then. We understood the anxiety, but we thought we could have did better. And I think when history looks back at this, I think this is one of the areas with in-person learning that history is going to suggest we could have done better, based off of the data that we certainly have. So we knew that the isolation was going to hurt the kids. We knew that a lot of the kids that are coming from backgrounds that have severe challenges, these kids face really adult problems when they're young people. Part of how they were getting better and getting through this was through the social workers and the mental health partnerships we had in the buildings. So even the people that were already participating to a degree no longer were. So the isolation has had a huge impact. We know mental health doesn't have economic boundaries. And so it's a county-wide problem that we needed county-wide solutions. And so that's why we did what we did with our programs, expanding the 3 tiers, right, the more social workers to address and help kind of identify those who might need help and get them into referrals. The second tier where families and start to work with professionals and you start to develop that structural relationship. And then obviously the mental health clinics in all the districts so that we have real professional support so that when we know we have a problem, we have the best professionals there to address that issue, and where we can do it in a way where the kids aren't missing out on classroom time. They're not having to get to this appointment there, or there. So we think the system, other is one of those post-pandemic challenges that we may have to do more. This may just be a starting point.
We've talked a lot about how this period has changed you as a leader. Has this period of time, this pandemic, as a father and a husband, changed your attitude towards mental health among young people?
Yeah, it has. I have 3 children, so the pandemic's impacted each of them differently, but you see it. My children have been, they have not been exempt to what this has done related to isolation and these school schedules. So you see it, and it's very tough as a father when you see your children suffering at all. It's very helpless. So yeah, certainly, you get to understand it better, and in my role, in the whole pandemic, you felt the anxiety every day. You still feel it that the community has it, right? It's just not as prevalent now that it was in different peaks. But you feel it in the community, you feel it at home, and we knew there would be some real challenges when we got through the threat of the physical virus, which we're not through yet, but opioids, mental health, suicide, all right here. We got a lot of work on our hands.
Have you worked out whether you're going to go do vaccines at high schools or bring them down here?
We will go to high schools. What we'll probably do is the larger ones probably have enough kids for us to go do a pop-up clinic there. And then what we'll probably do with some of the smaller ones in the regional high schools, we'll probably have a single point of location, work with the other districts to whether bus there. If they need help with transportation, certainly we can look to do that as well. So you'll probably have regional pods that we'll work with, but then we'll probably be in your larger districts going to them. I got a very good email. I hope she's watching this because I didn't get to respond to her yet. But she suggested that Wednesdays would be a good day for high schools here at the On Center too, because the larger districts don't have in-person learning on Wednesdays. So I read my emails. That's a great suggestion, and I'm going to talk to Ann about it right when we're done.
Or seeing any trends of people canceling their second dose?
I think what happens is we do have cancellations. I don't think it's a hesitancy issue. I think what it is there'll be a conflict in their schedule, and they'll say, I'll just go get it at a different time. We normally do get people reaching out to us about second dose cancellations, and can you get us in? And the answer is yes, we can. If you miss a second dose, reach out to us, and we'll work that through and get you in to get your shot.
If someone is homebound, what do they do about getting the vaccine?
Yep. So right now we have our partner at Essential Health. So we still get these, Trish, where we'll have people email us. I have homebound friend or neighbor is ready to get a vaccine. We then get it to our emergency management department. They then coordinate with Essentia to go get the shot done for them. Had a couple of those today. Anything else?
Brian, just to follow on the state budget that got approved, there's a very confusing resolution of the mobile sports betting issue. Have you heard any more from the Oneida, whether they're going to?
Yeah, I don't think that what happened, to your point, anyone understands really what happened, or even if the intent is to work something out with the Oneidas, I don't think it's necessarily in writing. So I haven't gotten updated today, but I do believe it's problematic what happened, and that we'll continue talking to the Oneidas on this. We agree with the Oneidas, and I hope we don't get to the point where litigation gets involved with this. So that could potentially lead to payments we receive being delayed. And again, we're big enough we can absorb that, but it's just a deal is a deal, and we had a pretty important deal. If our community, especially, we made the decision to partner with the Oneidas. At the time, they were already existing. They already run a very good operation, great employer. So to compete with the Oneidas wasn't probably in our best interest, but people would have come here. Like we probably could have gotten a Del Lago casino here. So to suggest that we're just like one of these other little counties that is just benefiting from some of this revenue, for us isn't the case. It made sense for us to be in the Oneida exclusivity zone, but we had other options. So we are being victimized if this goes the wrong way of revenue that's due to our community. Anything else?
Something else in the budget was hunting for kids who are 13 to 16, I think. Do you foresee allowing that in this county?
Is it a local, passed down to the locals? Okay. I like the model to give it to the locals to kind of review. I have not reviewed it. I don't know enough about what it is, what the demand would be, where you could do that. I know the legislature has a couple avid hunters over there that probably are more familiar with it. So we'll talk to the legislature then, and we'll have to get back to you on that. Anything else?
Did you have any reaction from your second shot?
Just some aches. Not bad. I was hoping that. Did you get a shot, Trish? Have you gotten one yet? Just checking. Okay. But yeah, no. Just some aches. I felt fine. I got through it. I've had worse. Yeah, we'll get you. Anybody in this room that hasn't gotten a shot yet, we've been talking about this for a while. I'll get you a shot. So